The largest hospital in Imperial County, El Centro Regional Medical Center, has started infusing monoclonal antibodies into people who are at high risk of progressing to severe COVID disease. They give these infusions early in the course of infection, before anybody has to go to the hospital. And according to the CEO of the hospital at El Centro, over 500 of their patients have received monoclonal antibody treatment. Half of those patients have avoided hospitalization, which is a significant decrease from the rates they were otherwise seeing. And so we look to these places in the country that are hardest hit, that have the most factors cutting against them in terms of how badly they have been affected by COVID. And you see there emerge among them and emerge from those places leadership, showing some of the best off places in the country how much better they can do at keeping people with mild COVID from getting sick and ultimately dying. Imperial County, California, one of the hardest hit places on the entire map in our country, is showing that these treatments work if you can get them to people, and if you can get them to people in time. Joining us now is Dr. Adolphe Edward. He is the Chief Executive Officer for El Centro Regional Medical Center in Southern California. Dr. Edward, it's a real honor to have you here tonight. Thank you so much.
Thank you, Rachel. It's great to be with you. I look forward to the conversation.
Let me just ask if the way I just explained it, if I said any of that wrong, or if I put the emphasis in any of the wrong place.
No, absolutely. You said it very well. Our community really has been devastated by the COVID pandemic, and we're using every tool in the toolbox that we have to be able to get through the day and make sure that our community is served.
These monoclonal antibody treatments, their public profile, I think, is small because monoclonal antibody treatment is hard to say, let alone the drug names for any of these drugs, which are absolutely unpronounceable. To the extent that they've got any public profile at all, it's a sense that they're a drug just for rich and well-connected people. You've absolutely proved that wrong with the sort of what sounds like considerable success you've had administering these to a lot of people, to hundreds of patients at your facility.
Well, we're very thankful for the support that we really received from the HHS and the team, Dr. Cadillac, Dr. Michael Anderson and others, Gina Smith. By bringing the team down here, we were already starting to use some of these medications to treat our COVID positive. But to add those teams to our existing clinical teams who are brilliant and worked really hard to take care of this community, we're very thankful to have had the support that we got from the state as well as from the federal government to be able to bring this treatment. And it's really not a good deal to have 70% of that treatment sitting unused, but using it for our own population has become a godsend.
Has it been resource intensive to do it? Is there cost to patients? I know that you have to administer these drugs as an infusion, which means people have to, it's not like just getting a shot. You have to sit there for an hour or so and be very patient while the drug is infused to you. Has it been an expensive thing for your hospital to take on at the scale that you've been doing it?
No, not at all. And I actually encourage my fellow CEOs across the country to actually open up their minds and their infusion centers quickly to care for their own community. I think today we've got to use every tool that we have because vaccines have been hard to come by down here in Imperial County. Having the monoclonal antibody has helped. What we've done is that we've used our vaccination drives, to pass the word out to patients, and believe it or not, we're getting referrals from people that would take that information, pass it out to their family member. We have one person who brought in 6 members of their own community after celebrating New Year, all COVID positive, all received the treatment, all now have a life to look forward to. So it has made a huge impact in our community.